Hey everyone, David here, and I've got some exciting news to share. I've decided to write a book, and I've entitled it Psychosocial Hazards Are Real. The book is intended to help clarify the fact that psychological safety cannot be achieved without paying attention to the psychosocial hazards people are being exposed to. Despite how much individuals might be interested in treating others with kindness, dignity, and respect, many cultures are so full of psychosocial traps that no psychological health and safety effort can ultimately succeed. But to address psychosocial hazards, you first have to know what they are, and you have to have some idea what to do to address them. Though the book won't be 100% complete until the spring of 2025, I'd like to share a unique opportunity to reserve a copy during the book presale campaign. The campaign will run from September 16th to October 18th, 2024. This will be an opportunity to get one of the first copies of the book, tickets to the book launch event, and other opportunities to learn more about psychosocial hazards. For more information, you can go to my personal LinkedIn or Facebook page, or the LinkedIn, Facebook, or webpage for ID2 Solutions. Don't miss out on this unique opportunity. Now, back to this episode of the podcast. One of the challenges in the healthcare system is a culture that sometimes is hesitant to face the reality of human error. However, a conversation is being had about adapting the near-miss reporting concept used in aviation to the healthcare industry. We'll talk about the value of near-miss reporting in healthcare up next on this episode of the Psych, Health, and Safety USA podcast. From Flourish DX, this is the Psych, Health, and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each week, we look at psychological safety from an occupational health and safety perspective. Let's talk psychological health and safety. Well, welcome to this week's episode of the Psych, Health, and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. So near-miss reporting is a vital part of any safety program. It involves identifying and tracking unplanned events that could result in injury or death if the occurrence actually happened. Near misses can happen in any industry, but are often not reported, often due to a lack of psychological safety for those in the systems themselves. This episode will deal a little bit with the importance of near-miss reporting in healthcare. So near-miss reporting in healthcare is vital for improving both worker and patient safety. Near-miss events are errors that happen during medical care that don't necessarily injure the patient. But reporting near misses can help the healthcare organization identify areas for improvement, such as weaknesses in the delivery system, and to prevent future adverse events. So it's my pleasure to have someone who knows a little bit about this topic to share some expertise about near-miss reporting in healthcare. And I'm going to start like I often do with an introduction of my guest by my guest, in this case with this question. So who is Heidi Raines?
Well, good afternoon, Dr. Daniels, and thank you for inviting me to join your podcast. I'm looking forward to talking to you about near misses. So you ask, who is Heidi Raines? So first, a little bit about myself. Earlier, you showed me my book. So I've authored a Forbes and Amazon best-selling book titled Shared Voices. The title is Shared Voices, a framework for patient and employee safety in healthcare. And this book was really born out of my desire to share information in a very practical way so that healthcare employees can make an impact far sooner than I ever did. I'm also the founder and CEO of Performance Health Partners. Our software is a class research rated, it's actually the number one rated software for safety, risk, and compliance in the US. And Becker's Healthcare just named us one of the top 25 healthcare softwares for 2 years running. So, this leads back to who is Heidi Raines. So my vision and passion and mission is that through tools and, through technology tools, we can prevent patient and employee harm. And really by empowering all those involved in the care experience, including patients, their caregivers, and healthcare workers, to share observations before harm occurs, we can make care safer and reduce burnout and improve psychological safety. I also hold a position as a preceptor faculty at the Tulane University's Master of Healthcare Administration, where I have the greatest privilege of training healthcare leaders. They spend a year within our company, and we really train them about the experience of being a healthcare leader as a whole. And so beyond my CV, I'm committed to advancing patient and employee safety by advocating and developing learning resources. And you can see that if you go to our website or in the book. There's really, over 500,000 people a year will come and access our learning resources just to learn more about patient and employee safety.
Wow, that's quite a bit. That's quite a bit. Yeah, yeah. That's quite a bit, and such an important role to, or such an important focus on folks who are in what has to be our most important industry. I mean, it's hard to argue that anything is more important than the healthcare system, because dead people don't pay taxes, don't contribute to the economy, don't make great communities, don't really contribute to anything other than a plot or their ashes spread someplace. I mean, that's kind of a really direct way to talk about it. Again, I spent a number of years in the pre-hospital side of the healthcare system, and it is absolutely essential that system work well for all of us, to include the people who are doing the work and the people who are going to receive the care, and they're both necessary. You can't have one without the other. So really, looking forward to getting into this conversation. Before we do, one other kind of standard question I ask folks is, what does psychological health and safety mean to you?
Yeah, to me, psychological health and safety in healthcare means creating an environment where patients and healthcare workers feel secure, supported, and understood. It's about ensuring that they can express concerns and seek help without fear or stigma or retribution. Psychological safety in healthcare is also about eliminating those obstacles to improve care for both patients and employees. And the three big things are, eliminating the fear of blame. You want to eliminate the fear of losing their credibility, or eliminate the fear of disciplinary proceedings. And this is really, really important in hospitals, clinics, and other healthcare settings, where speaking up about a mistake or an issue can prevent harm and improve care. It really does affect another human life. So you did talk about it. Physical safety and psychological safety benefits not only the culture of care, but also the caregivers, and it aids organizations in other very important ways, such as patient experience and staff retention, which are all really hot topics with healthcare leaders. And we've got some really great data on that, right? Healthcare workers who experience psychological safety in the workplace are more engaged. They tend to have lower rates of absenteeism. Employees who feel safe to speak up in the workplace also take, the steps needed to provide better care without the fear of being blamed or criticized. And some other stats, it's like they're 2 times more motivated. They're close to 3 times happier, close to 3 times more enabled to reach their full potential at work, according to a 2024 report by Boston Consulting Group. And then also another survey on psychological safety in the workplace confirms that reporting 12% of employees with the lowest levels of psychological safety, that they were likely to quit within a year. So improving this really does improve all the other things that we're trying to achieve within the healthcare organization as a whole.
Wow. And this is the kind of information that hopefully folks are starting to embrace, because a lot of our conversations around psychological safety, the area I focus in, the psychosocial hazard mitigation, have been anecdotal, that it seems like a right thing to do, but we now have more objective quantitative data. It can be proven. And the other thing that you said that I really think is important is removing the obstacles. I'm of the belief that you can get psychological safety sometimes by accident, because you simply get folks who kind of like each other and it feels okay and they kind of go together and do some things. But if you don't change the environment itself, you can't keep it. Even the people who originally, when they started, it was great, but we're now 2, 3, 4 years down the road and it's gotten kind of stale and old. Why? Because the environment didn't mature like the people did. It didn't change like the people did. And often that's the issue. It's not this horrible hospital administrator. It's this horrible system that limits the hospital administrator's ability to do what's effective and what's important because of some rule that was written 25 years ago, or some way we've always done business that is no longer viable, and it limits all of us from creating the kind of environments that we really want. So removing those obstacles is just as important as trying to create that wonderful environment.
Yeah, you mentioned more studies and more information, and we really do have more of that coming out. And you see the kind of prominent organizations, research organizations looking at that. For example, there's a study by the Joint Commission Journal on Quality and Patient Safety on the impact of psychological safety. And they looked at radiation oncology, and researchers found that psychological safety was associated with more reported near misses, which ties into our near miss conversation that we're having, because healthcare workers were more willing to share their observations. And that near miss reporting is really essential to quality improvement efforts, because we can uncover those causes or potential root causes of harm that could lead to adverse events. So we do have more studies, more data that's coming out. Super interesting. That, for example, there's more data that looks at psychological safety, and it's associated to better health outcomes and lower morbidity, lower mortality, and in intensive care units. And this is mainly because staff such as respiratory therapists or nurses can speak up about what they see and know, and get those interventions in there sooner.
That's really exciting, to be quite honest. One of the I mentioned before we recorded that I was involved some years ago in helping design the firefighter near miss reporting system, and we met with some folks from the FAA. And the way they described it, they said that what it used to be was this, what they call I think it was the white handkerchief kind of, mentality, where back in the day you had one person flying an airplane with the white scarf kind of flapping, and some of those folks came into the commercial airline industry with that same kind of mindset that I'm the pilot, I tell everybody what to do and no one should question me. And I believe that command and control kind of leadership model exists everywhere, to include in hospitals, that I'm the doctor, I'm the surgeon, I'm the whoever, no one can question me. But what has been found is that, we have to be able to question you because you're a human. And you can't see everything. You can't know everything. You can't feel everything. And there are other people in the room that have things to contribute if we're open to it. But that's why I create that environment. So we have to be open that, there are all of these qualified, great people around this patient. We all have a way to contribute to helping this person get better, or we can watch you fail and not say anything, which isn't good for any of us. Good for any of us. So I wanted to ask, you mentioned a little bit about your background, but so what sparked your original interest in healthcare? Let's go back a little bit.
Let's go back. Let's go back into the crystal ball there. You see, we can go real far back. So, I grew up in a small, very rural southern town, and I grew up without access to healthcare. So I received immunizations from our local rural health clinic that was run by the state, but just traditional care, not unlike many Americans, was only sought through emergency room and with emergencies. And there was a woman physician that was in our town, and she worked at the local healthcare clinic. And that's who I would usually see. And then when I realized that working for this practice would allow me access to care, I asked her for a job. So, so I started working the front desk of a rural health clinic at the age of just about 17. I would think I was probably still 16. And that's where I got my start in healthcare. And, she had a very innovative way of looking at healthcare. She had a sliding scale, which, was pretty innovative at the time. And this experience really helped me understand the challenges surrounding access to care. So that I'm very passionate about access to healthcare, but it also showed me the unwavering commitment of the clinical staff to really provide the best care possible within the constraints of their resources. And then I also got to see the patient's perspective. And this really shaped my passion for rural health, access to quality care, and the deep appreciation for our healthcare workers. And that's just really where it started. And after that, post college, I went on to be a healthcare consultant, and then I worked my way into healthcare systems where I ran the sections of hematology, oncology, and radiation oncology. And when I really started to see more and more gaps around safety, and it became clear to me that as healthcare leaders, we need to provide more tools, and we need to provide a more psychologically safe environment for our workers so they can proactively share those observations about the environment of care they're working in.
Wow. I have to admit that is so when somebody like writes a book and all this stuff, you don't expect that behind that is that kind of story. To be quite honest, you start off at the front desk of a medical clinic in a small town. Those are typically it's like, oh yeah, my mom and dad were doctors, and and I went to the big thing, but that I also think it's really important or I believe that people really can make a difference when they don't forget where they came from and what it was like for them. That really personal experience of not being able to have access to something is sometimes the passion that drives us to not only get better care ourselves, but to bring other people along with us. Because it's
I recently spoke at a rural health conference, and it was mostly state-run health clinics, like the one I received care in, and was presented as being an author, and they read my bio, and after that I gave them a little bit of information about myself, and I said, I say all this because I want you to see what one of your patients, one of the people that you are taking care of, can and will become. And it was just so great. I love the rural health conferences. You can tell I have a piece of my heart there. But
right. Oh, absolutely, absolutely. It is important for people to see themselves in others, to see or to see make connections between the people that they see all the time and others. Because again, I think we get lots and lots of images through media, through books and stories, and where we read other places and we go, well, yeah, that's not happening here, or that really, yeah, it is happening there. Yeah, I mean that you never know where the person who's going to solve our next huge medical, challenge, they could be living in the middle of, a town with, 500 people. They could be in the big city. It could be anywhere. And it is so important. Again, I just, that it's really important what you said, that we consider that no matter who these folks are, they deserve quality care, and they deserve a system that can continue to deliver that quality care in a reasonable, and a cost-effective way as well. Because a lot of the issues, the barriers that we have, they're financial. Those who have money can fly to wherever they're they can fly anywhere to get the care that they need. They probably have a hospital down the street, but there are others that are not so fortunate. So, if you were giving your assessment of the state of safety in the healthcare industry, what's your thought about where we are?
I'm hopeful. I would say psychological and physical safety of healthcare workers definitely still remains a critical issue. It's our body of work. It's what we are working on as a healthcare system right now. When you think of value-based care, well, patient safety is a cornerstone of that. But especially in the aftermath of the COVID pandemic, it really exacerbated and shined a light on the patient and employee safety challenges that we're seeing in healthcare. We have approximately 1 in 5 healthcare workers have left the profession since the pandemic. And then if you look at nurses, there's one survey that like 90% of them are considering leaving the profession in the near future. So that's a lot. And then workplace violence, continues to be a significant problem in healthcare settings. And I didn't realize this until I was doing research for my book, that healthcare is actually one of the most dangerous professions. When you think of, police officers, you've got your usual industries that you think of. But even being in healthcare, right, I didn't think of healthcare being one of the most dangerous professions, but it is. So, 8 in 10 workers have experienced at least one type of workplace violence in the last year, and that's from 2023 to 2024 in that data. And nearly half of nurses, so like 45%, reported that they're seeing an increase in workplace violence in their unit within the previous years. And in contrast, only 3.8% of those nurses reported that workplace violence, and did a decrease on their unit in the previous year. So despite we're having a prevalence of such incidents that often go underreported, we still have work to do. We really do. Couple that with staffing ratios continue to be a challenge, and that's overwhelming our healthcare workers with the increased workloads. You've got the increase of schedules, violence. It's leading to unprecedented levels of burnout.
Yeah, and again, to the mention that you made of the pandemic, and I say this often, that I'm not convinced that the pandemic changed much of anything, but it exposed most of everything. It simply shined a light on things that were already there. So again, the analogy is those businesses, for example, that went out of business were already struggling, and the pandemic just pushed them over the edge. They were undercapitalized, they were understaffed, they were under-resourced, and they didn't have the margin to be able to survive. And sadly, even many of the folks who died as a result of of COVID-19 were those who were already sick and who already didn't have weren't resilient enough to be able to fight back. And so again, in many ways, COVID just made what was happening already worse, but it was already happening. It didn't necessarily cause it; it just exposed it, and particularly in the healthcare system. And it's interesting to me that when I've said this before, that disasters make us more of what we already are. So if we're prepared, we get an opportunity to implement our preparedness plans. If we're not, we get more disorganized. And sadly, while, so March of 2020, for about maybe a year, we were all focused on, our healthcare workers are frontline and they're so important and blah, 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 blah. And then you started to hear we have to get back to where we were before. And I think that's a part of the problem. It's where we were before is not where we should be going. We should be looking to get better and use this experience to get better. And so on the one hand, I heard you say that you're optimistic, and that's a good thing, that there are glimmers of hope. But there's a part of me sometimes that says it just needs to happen faster, kind of one of those who wants to see it happen quicker. But it is good that there are, folks, again, such as yourself and others that are trying to wave the flag and help people get better.
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the FlourishDX Academy. www.45003.org. Now back to this episode.
Talk a little bit about what does a near-miss reporting system in healthcare even look like? For those who, how could you do this in healthcare? What is that? Share a little bit about what that does look like.
Sure. And this is the part that brings me optimism. So we're seeing a movement begin to sweep through healthcare. Near-miss programs have grown in larger health systems, but now they're moving to smaller hospitals and a post-acute care organization. So just as healthcare with people focuses on preventing disease, we are starting to do the same in the safety space. So we're implementing systems and programs to prevent harm or identify the root cause before harm occurs. And one way to do this is through a near-miss program. So you may want me to explain, what is a near miss? And so we define a near miss as an interception of a potential safety event before a patient or employee is harmed. Some organizations will reframe this and call it a good catch. And the goal is to foster that culture of reporting and submitting information. We call it information. Information is data points. So really kind of destigmatize that. So it's whether it's a near miss, it's a true incident, or it's simply an observation. By focusing our energy on preventing harm and learning about what's going on in the healthcare organization, that brings value. And the value of a good catch or near miss is that it interrupts the cycle in a chain of events and changes the focus from reactive to proactive risk management. And that is really what we're focusing on. My kind of message and mission is to look at this proactively and to really understand near miss programs. We'd have to dial it back about 100 years. You mentioned aviation and other industries, but in the 1930s, there was an American engineer. His name was William Heinrich. He developed a model for understanding the scale and scope of safety, or the lack of it, in high-risk industries. And it's called the Heinrich ratio or the pyramid. And it's influenced safety programs across industries for the past 100 years. Like you said, you've worked on this in other industries before. And really the theory looks at for every serious event with injury or death, that there are approximately 300 near misses and 3,000 latent risks creating unsafe conditions. So when there was a study that looked at this theory and applied it to healthcare, and in healthcare, we're looking at it to be even in a more minimum, margin for error, that our good catches or near misses occur up to 100 times more frequently. And this means we have 99 opportunities to prevent that incident with harm. And that's a lot of chances to prevent harm from occurring. So by addressing the cause of the near miss or the root causes, we can prevent that significant event.
Wow. Yeah. No, if it just makes sense. I mean, if you really think about it, it absolutely makes sense. Why would we want to wait until? Uh, so you certainly know more about these than I do, but some of the practices of drawing which limb it is we're going to be doing surgery on. I put an X. It's going to be this one, right? And asking the patient, yes, we're going to work on this muscle. So we write on the limb. So by the time the person gets into surgery, they know which limb, because errors happen. Is it the person's left or my left? Is it just
Right. Yeah. And we get asked often, one thing that, if you're rolling out a near miss program, is the organization really needs to define what a near miss is, because that's part of the learning and the education. And some examples, like you said, drawing on a patient's limb, but it could be, placing the wristband on a mother instead of the patient with the baby, or, in chemo, where I worked, it could be a chemotherapy drug labeled incorrectly. A good catch could be the rights of administration were checked and it prevented a double dose from occurring. That would be something that would be shared, or what we call reported, so that we could celebrate that. So it's the goal of that near miss reporting program is to foster the culture of sharing information by really infusing the energy into continuous learning, preventing harm, so that 1 in 100 doesn't occur, and then identifying that root cause or potential root cause.
When you're sharing that story, it occurred to me the classic movie "It's a Wonderful Life," where the kid is working in the drugstore and Mr. Gower puts the wrong medication in a place that could be administered to somebody and hurt somebody, and it's a kid who says, look, that Mr. Gower, it's wrong. It doesn't matter. And this goes back to the point about everyone feeling that they can speak up, because it doesn't matter. It could be, someone who's, cleaning the hospital. It could be someone who's delivering food. It could be a nurse. It could be anyone who sees something that looks out of place, that looks like it shouldn't occur in that way, to say, has anybody noticed this? Has anybody noticed that? And just that small opportunity to be able to share. I was on a flight, this has been a few years ago, and we were sitting in the seat right in front of the exit, and they closed the door, and they flipped the little switch that's supposed to arm the slides, and there's a light that was supposed to go on that didn't. And so there's another flight attendant, they'll come around, they tap it, and the light doesn't go on. So they grounded the flight until someone came and replaced it. It was a light bulb that was out. But they weren't going to take off. Now, they said everything was working, but because that bulb doesn't work, we're not going to fly. And that is the example of, this is one of the reasons why we haven't had people haven't died in airline crashes in the country in years. It's because of that. It's that level of detail that says, no, we can't let that slide, because that one thing, that one issue could injure or kill someone, and we're just not going to let it go. And why should we? And it doesn't matter who picks it out.
Sometimes it's our most simple interventions, like with your example, technology aiding them. It's a light bulb, right? So they see a light bulb and they know something that something needs to be attended to. And sometimes it's a really simple technology interventions that aid humans that are the most effective. And when we were designing our software, that is kind of a core design belief that we hold near and dear, is that technology has to be accessible and easy to use. And you mentioned somebody in facilities being able to use it, and that was one of our big celebrations when we implemented with our first health system. It was that somebody within facilities was cleaning a unit and found a sharp not in the sharps container, in a regular waste can. And they were able to go to their nearest terminal and click on a very simple icon and report that information. And so there are many things of like the simplicity of it, the ability for anyone to have access to it, anyone from facilities to patients to, nurses on the floor. All of that information is incredibly important. And the way that technology aids that is that taking the real-time information and data, you can look at trends, and then you can see what needs the most attention or what is occurring within an organization. So that really provides the insights. It allows the organization to take action and understand that root cause. And then it leads to prevention, right? Recognizing and they implement actions to prevent anything from happening.
Yeah, it also gives people who might otherwise not feel a part of the system. It gives them the sense that I am really a part of this. We're all in this together, and everyone, again, from someone working in facilities to the CEO. Ultimately, the goal should be to keep our folks safe and provide great care. And everything that everyone is doing is connected to that in some way. I mean, it's all connected. And often what, organizations kind of fail to do is they fail to help people feel connected because things are so, well, that group knows how to do it, but I just don't understand how to do it. And it's not that I'm not an intelligent person. I just don't understand that. I mean, I used to teach CPR back in the day, and obviously was a firefighter and EMT, and I can recall having people in my classes who were surgeons, but they just didn't do CPR because there were other kinds of, they were foot surgeons or whatever, but they had forgotten, the stuff they learned in medical school about how to do CPR. So we all have areas that we're not great at right now, and maybe I used to do it years ago and I don't remember right now, but if there's someone in proximity to me and the system is simple enough for them to participate, it allows us to all contribute and all feel like we're a part and all feel like, so that one person's observation about that sharp could have prevented all kinds of things. Someone else getting stuck by it. There's all kinds of, issues that were avoided by one person's observation and a system to be able to collect that data and use it for the improvement of the system as a whole. Yeah. So what do you tell folks, or what do you share with folks who are concerned that, wow, we've got to, that's why our malpractice insurance is so high. We can't tell about that type of thing because folks are going to sue us and it's going to hurt our reputation. What conversation do you have with folks who feel that way?
Yeah, there's data that supports having a program like this. So when we hear concerns that incident reporting could potentially harm an organization's reputation, let's be clear, the opposite is really occurring. When they embrace transparency, it shows confidence and commitment to the employees and patients. It's about being upfront where we can improve and we can show that, the organization can show that they're actively working on making the facility safer. And this transparency, builds trust. When they're openly addressing the near misses, which is an opportunity to address it and learn. It's one of the most powerful tools that we have, is being able to learn from something that nearly happened within your own organization. It's almost like a case study. So this approach really does strengthen the reputation, and that starts from within. So it strengthens the reputation from within, and it shows the dedication to excellence and continual improvement. So that's what we'd usually look at and really reinforce with hospitals. I mean, I have spoken to organizations who, they'll say, well, we don't have any incidents. And that is one thing that we take as I don't want to say a red flag, but a lack of awareness and commitment to a safety culture. Because the truth is, I've worked within thousands of healthcare organizations at this point, and it's happening to all of us. We are humans. Systems have failures. It's no organization is immune to having things go awry.
Yes. One of the topics that I, but focus on a lot is so a psychosocial hazards exist everywhere, and they have nothing to do with the humans who happen to be there. They're they're just a part of the system. Now, a human may have initiated the hazard, may have written the policy, started the practice, did things a certain way, but when they did it, it worked for them. I mean, if you think about it, again, another one of my sayings, I do everything perfectly for me, which is why I do it that way. It may not work, and it's probably not perfect for anybody else, though. And I think sometimes people start things, including opening up health clinics and hospitals, with the perspective of the CEO, the board, the leadership. This is what we think is really great and is going to work really well, but it doesn't necessarily work that way for everybody. And it's not that what they did is bad. It just, we're so diverse. Our views of the world are different. Our needs are different. And it just doesn't work for everybody. And
Yeah, in
so,
healthcare, there's hundreds of factors. When you look at something that happens, there's hundreds of factors. And when you look at the factors that we have and you aggregate them, you can see that less than 30% is attributed to a human factor. So, you're really looking at 2/3 of it not being a human factor. And if you have a highly educated, someone who has gone through training and education within your organization, and it's reoccurring. So that's when you really can see that if it happens with one, it's going to continue to happen with other humans. So we are looking at all factors and keeping in mind, if something does happen, we don't ask who did it, we ask what happened, so that we're not looking for the human component or factor.
yeah, not a culture of blame, but a culture of explain. I mean, what happened? So the system can be changed, because I am a believer that the vast majority of the issues are not the people. They're not the vast majority. And I think the work that Deming did back in the day suggested that 95% of the time, the issue is the system, and only about 5% is actually the person. Because if you switch out the people, the same things happen, because that's how the system's designed. And we should be paying attention to systems. It's important to get people that can operate in those systems, but it's also important to get people who can operate in spite of those systems, and recognize that they're just not producing what we want. So, how can a focus on employee safety in healthcare improve patient outcomes? What's your thought there?
Yeah. Patient outcomes, it just kind of rolls back to the care that they receive, but also, sorry, let me reset on that one. Okay, so you asked, how can a focus on employee safety in healthcare improve patient health outcomes?
Yes. It's how focusing on again, there are sometimes these conversations about how can we make it better for the patient, but I don't know that that's doable without paying attention to the person who's treating the patient.
Sure.
Yeah.
I have a really good kind of data story for that. So, again, research shows that near misses are significantly underreported, but they bring tremendous value. And the American Data Network's PSO, which is a patient safety organization, really did confirm this theory or show this theory within research and data. So it shows that near misses represent, well, what they saw in their PSO is that near misses represented only about 6.8% of the events submitted at that point in time. So they launched a Good Catch campaign within their PSO, in which 45 hospitals participated. And overall, they saw a 45% increase in near miss reporting over baseline. And the participating organizations reported an average of 246 more near misses per month. So that statistic really caught my attention because that, one of those statistics was that 63% of participants saw a decrease in overall patient safety incidents related to their near-miss corrective actions. So the campaign was so successful that 100%, or all 45 of those hospitals, continued the near-miss campaign the following year. So, out of that, one of the key interventions that we use is one of those simple intervention, and that is acknowledging and rewarding staff as a key factor of sustaining the reporting campaign. So 68% of those 45 hospitals acknowledged that rewarding the staff was that key factor. So that is, some of our organizations will have a near miss or good catch award, or they'll highlight it in their newsletter, and they also will take, a good catch or kind of a case study, and then allow that to be presented and have the staff learn from it.
Yeah, that's actually what I would have hoped you would say, that there. I didn't know it was, the numbers were so high, but and what you described really is about again, removing some of the obstacles to do what people would probably do if they knew they could do it without some negative impact. When people tend to rise to the bar that's set. They tend to, if you create the space, they'll tend to fill it with their actions. But they'll also, shrink, and do less if they feel they're going to be, disciplined or counseled or whatever. If I speak up, is there something negative that's going to happen to me? And if those obstacles are removed, then it's actually endless, the things that human beings can do. Because most people, I should say, don't go into healthcare because they don't care about other people. They do. They really want to help others. They really want to be, the kind of person who will do good things for other people. And again, it's often the system that makes that difficult. So as we wrap up a little bit, if folks want to get more information about you, they want to order a book, they want to get some support from you and your organization, what's the best way to do that?
So our website, it's www.performancehealthus.com, actually has a huge amount of resources on of this whole body of work, as well as case studies. And as I mentioned, there's over 500,000 people and users that come to our website each year just to look at the learning resources. I have a funny story about that, is that we were testing an AI tool, and we put in root cause analysis for research, and our company came up as one of the top cited bodies of work on root cause analysis. So we had to actually opt out and just kind of exclude our website of that information. So I encourage everyone to go to our website, use any kind of the resources, tool, blogs that we have out there to offer. And then also the book, Shared Voices, is available all major outlets. So Barnes & Noble, Amazon, Target, it can come on any of those places. So you can pick up a copy of that. And no audiobook yet, as if you've thumbed through the book, there's a lot of diagrams and data points, and that doesn't always equate really well to an audiobook.
Well, again, Heidi, thank you so much. First of all, for your body of work and for your contribution to making or to causing the healthcare system to be a safer place for both the people who work there and the folks who receive care. It's a really important thing that you're doing, and it's so interesting to be able to meet you and hear your story of from the front desk to the to helping to change the system. So thank you very much. I appreciate that so much. And so if you're watching or listening to the podcast for the first time, welcome. I hope something that you've heard will bring you back to episode in the future. Previous episodes of the podcast can be found at psychhealthandsafetyusa.com. You can watch, like, subscribe, and share the podcast on the Flourish DX YouTube page. And please do join the Psych Health and Safety USA movement by connecting and becoming a subscriber on LinkedIn. So until next time, stay tuned and look out for the next episode of the Psych Health and Safety USA podcast. Tune in each week for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to david@id2-solutions.com or go to the Flourish DX website at flourishdx.com. We'll see you next time.